Congressman, if it comes down to 1 day a week being schools open, is that open to you?
Well, thanks for having me on the show, Neil. You know, any amount is better than nothing, but I mean, you think of the millions of children who get their behavioral health counseling at school and many other resources, healthcare through the school nurse programs. It is absolutely hurting children to have them out of schools. I had a great conversation with Dr. Redfield back in August when he said it hurts children to keep them out of school, and yet, you know, you have many of these states that haven't done so. Here in Tennessee, we've done everything we can to be open. You know, the issue becomes a supply of school bus drivers and substitute teachers, but the challenges are being met here, and there's no excuse for it not to be happening elsewhere.
You know, Congressman, here I want to tap the physician side of your fine brain, and that is the J&J's CEO apparently talking about the possibility that a lot of people are going to have to look at COVID as like the equivalent of the flu, and that you'll need to get shots every year. What do you think of that? You know, that this is an annual event that we just have to build into our medical preparations every year?
Well, it's a great question that we don't know the answer to yet, Neil. If you look at the length of data that we have, we just don't have, you know, 10-year, 20-year studies on how effective the vaccine will be over time. We know the ones that have been repeated on patients who got vaccinated early in the trials are still holding, so that's good. I don't know about J&J's vaccine itself. I know its efficacy was a little bit lower, although still very, very good and usable as an approach. Maybe their data is showing something different. I don't know. I'd have to go look at the data, but it's just an answer we can't give right now because we don't know long term what it's going to look like.
You know, we were talking about the CDC a little earlier, Congressman, and they're weighing into the whole double mask thing. And arguing that it could slow the spread of the virus. Might be a good idea. Where are you on that?
So the prospective studies that I've seen, and you know, the prospective studies are the ones you really want to rely on. There seems to still be conflicting data. So I'd like to see the study that they're using and look for, you know, things like selection bias and the other things that you, as a good clinician, would look in a study to make sure that the study's valid. But what I've seen so far is very conflicting data. The Annals of Internal Medicine published a study where they gave people masks. Half a group had masks, half didn't have masks, and the mask did not make a difference. And that was a 6,000 patients. You know, the sample size was huge. So the confidence in that study can be pretty high. There's also a meta-analysis which took 74 different studies and kind of combined them statistically, done by the Lancet, that showed very low confidence that the mask made a difference. So you've got these conflicting studies out there where there are some that say it does help. We just got to keep looking at it and get real data that doesn't have selection bias and other types of bias.
Congressman Mark Green, thank you very, very much. Good seeing you again.
Thanks.